Indonesia, world's largest island country, with its massive volcanoes, endless rice fields, beautiful beaches, Indonesia attracts many people every year. Not only does she display great natural diversity, but also rich cultural landscapes showing both her traditional and modern sides to the world. It is not odd that the Indonesian people are so proud of their country. However, a dreadful danger is lurking in the shadows. Living between the many creatures of nature, there is one that could bring a terrible fate upon humanity. The dengue virus is transmitted through mosquitoes. Mosquitoes from the Aedes aegypti family are the primary vectors. These mosquitoes carry the dengue virus, and when they bite people, they are able to infect humans with this virus. The Aedes species of mosquito prefers to breed in places with still water, like reservoirs and water basins, which are very common in Indonesia. The mosquito is mostly active early in the day between 9 and 11 a.m. and when it starts to get dark at night. When the rainy season comes along, this is even more noticeable as the Aedes mosquito thrives in warm, humid and wet climate.
Dengue in Indonesia actually is an endemic disease in Indonesia. So we have a lot of cases in Indonesia, and these cases could be fatal if not recognized and treated as soon as possible.
This dangerous virus does not only cause dengue fever, but it can also lead to some serious complications. Dengue hemorrhagic fever, dengue shock syndrome, and expanded dengue syndrome. But what makes these so hazardous? Dengue hemorrhagic fever differs itself from normal dengue fever due to the leakage of plasma in the blood vessels. If it is not treated adequately, it can ultimately lead to dengue shock syndrome. This syndrome is the fatal manifestation of dengue itself. Shock is a state where organs and body tissues are receiving an inadequate level of blood. This severe lack of oxygen, hypoxia, causes multi-organ failure and will eventually lead to death.
And there's one more which we call expanded dengue syndrome, if you ever heard of it. So that one is when there is a manifestation of organs, such as they can have encephalitis, encephalopathy. They could have a severe hemorrhagic manifestation, hematoscasia, melena. That is what we call expanded dengue syndrome. Take-home message is that dengue disease can be a severe one if not treated adequately. There was one patient that I still remember very clearly. I remember the resident was intubating the patient and I was helping to give fluid because she was in the shock state at that time. The patient was having a very severe dengue. She was intubated and was moved to the ICU because of the severity of the shock itself. There's one experience that I think I won't forget because it's still very clear in my mind.
So, what are the possible treatments?
A viral disease is limit itself symptomatic drug is need, and then the most important thing is we have to balance their fluid. So that's why when we have a patient who have a good condition with suspect dengue, they can be sent home. They must take adequate oral fluid. For patients who stay at puskesmas, who need to stay at puskesmas, we can give them body fluid, intravenous fluid, and then we observe them every 6 to 8 hours per day.
In other words, there is no cure available for dengue. Not yet. Now, we can only give the patient supportive treatment. Fluid. Depending on the severity of the dengue infection and the condition of the patient, the treatment will be more or less aggressive.
So about the pathogenesis of the dengue virus, before I go to that, so we have to know that there are 5 different serotypes that we have of dengue. So there's then 1, then 2, then 3, then 4, and then 5. But the most prevalent serotype is also then 3 in Indonesia. Yeah. So patients who develop a second time infection by the different kind of serotypes will have more severe manifestations of the dengue itself due to the humoral response of the body and also the T-cell mediated response of the body.
The funny thing with dengue is that the first infection has mild symptoms, like fever and rash. But from the second infection onwards is when things can go wrong. What are precisely the symptoms of dengue?
So fever is the most important sign. Sometimes patients feel nausea and vomiting, itches all over the body, retroorbital itches, and then when you do the tourniquet test, it will be petechiae. Petechiae is more than 10 petechiae around your cavity area. So if you got that sign and some symptoms, you can plan about the treatment.
Okay, the diagnosis of dengue itself. So we will suspect dengue in patients who has at least 3 days of fever in Indonesia, and they will have other risk factors such as they are living in endemic areas, yeah, and also other symptoms that probably not as specific, such as viral-like illness like flu, runny nose. They can have a headache, can have myalgia. Sometimes they have a bone pain, especially at the back, which is what we call with breakbone fever.
To support the suspicion of dengue, lab tests are used. The NS1 antigen and the immunoglobulin IgG and IgM test. The first 2 days, the NS1 antigen test is used. This test is effective to diagnose the dengue infection early. On the other hand, the immunoglobulin test is used to diagnose a current or a recent infection. This test has the most effect when it is performed after at least 7 to 10 days. The human body produces the IgM antibodies first, then the body will produce the IgG antibodies. After a few months, the IgM antibodies will disappear. However, the IgG antibodies will remain detectable for a long time. Because of these characteristics, the test results of a second-time infection can be misinterpreted. Limited medical supplies can also lead to misinterpretation of test results.
The challenges in my current setting, the puskesmas, is that in patients with probably more severe manifestation, we need to perform a more vigilant monitoring, that is including blood work. So because in the puskesmas we don't have the lab for 24 hours, the lab only opens in the morning, so we couldn't do the blood check frequently. as what we needed. So in that case, for the sick of patients, usually we have to refer the patients to the hospital so that they can have their blood monitored.
Monitoring does not only happen in the hospital. Groups which have a high risk of falling into a critical state will also be monitored closely. These groups have a higher risk to get infected by the virus than the rest of the population. These are people who live in endemic areas, next to still water, in small neighborhoods. People who have a lowered immunity are also more at risk. Especially elderly and children are at risk for complications of dengue.
So I think the most is the unawareness of the people in our puskesmas area. So they usually come to our puskesmas when their condition is get worsened. So it will be really difficult to us to cure them. That's why we should refer them to the hospital. That's why our puskesmas have a program, to give some education about how to keep our environment clear. So we have a program in our puskesmas called 3M, which is burying, and then covering, and then training. So we teach, we give people education about how to keep our environment clean so we can eradicate the mosquito.